Welcome to this Whole Life Action Hour. I am Ocean Robbins, your host, and I am thrilled to be here with you now as we're going to talk today about dental health, oral health. You know, your mouth is the gateway to your body. So how you care for your pearly whites affects the health of your microbiome, your bones, and every cell in your body. But there's more to dental health than just brushing and flossing and the occasional visit to the dentist, as important as those things may be. In fact, what you eat and how you live also have a profound impact on the health of your teeth and your gums and the brightness of your smile. And plant-based eaters actually have a unique set of dental concerns that are important to address. So today we're going to be looking at the role of diet and lifestyle in oral health and the connection between your oral health and your oral health practices and your overall health. Now, I want to be very clear before we dive in any further that nothing you hear today is medical advice. This is coaching. We're sharing our best insights, but of course, you should always consult with a qualified healthcare professional regarding your specific medical issues and needs. That said, you are going to learn a lot today. This is a project of Whole Life Club, which is Food Revolution Network's ongoing membership community, and some of the questions I bring to this interview come from our Whole Life Club members. Now, we are here today with Dr. Helen Voronina, who worked in emergency, surgical, and cosmetic dentistry before opening Dr. Helen's Dental and Implant Studio in Melbourne, Australia in 2008. Dr. Helen's implant work has restored the smiles of countless patients, and her core passion is promoting overall health so that invasive and costly treatments can be avoided. She is an advocate for animal rights, and she promotes a whole food, plant-based diet for health, ecological, and compassionate reasons. Dr. Helen, welcome. I'm so glad to be with you.
Thank you, Ocean. It's a pleasure to connect all the way from the other side of the world.
Indeed. I'm in California. Dr. Helen's in Australia, and we're here with you wherever you are watching us from. We're glad to have you with us as well. So, Helen, lots to talk about here. You know, there's some research that links the oral microbiome and periodontal disease to lifestyle diseases like obesity and cardiovascular disease. Is there really a connection between oral health and overall health?
There is indeed a connection, a very strong connection. It's a very interesting subject, and it's what I might say to you is that there is a very strong link, yet this is an emerging topic. There is a lot of research, but there is probably not a lot of consensus. But there are a few areas or quite a few studies that we're aware of that link oral biome to cardiovascular disease. For instance, people who have heart attacks, they seem to have the same bacteria in their heart as they do in the mouth. Also, we've known for many, many years that septicemia, which is a condition where bacteria from the mouth can travel through the bloodstream and cause infections in other organs, is also linked to oral biome. Now, an interesting study conducted in Pennsylvania demonstrated that patients who had septicemia and infections of other organs in the body, at least 50% of them were caused by bacteria from the mouth. So it's very, very important correlations there. In fact, cardiologists and orthopedic surgeons, when they do surgery on their patients, they always ensure that patients come to see a dentist before, to make sure that their oral cavity is completely healthy and that there are no infections, to reduce the risk of septicemia.
Got it. Now, plaque is bacteria, right? That are feeding off of typically sugars in the mouth, right? And
1,100 different species in the mouth.
Wow. Okay. And we just see this white stuff and we just call it plaque and think it's bad, but there's a lot of different ones. And some of them probably are good for us, right?
Some are good, absolutely. It's a colony. In fact, plaque is interesting. It's we think of it as harmful, and it is actually harmful, but it's got protective features as well. In the way when teeth are covered with plaque, perhaps they're not as susceptible to acid damage. But having said that, I wouldn't think of plaque as positive, as a beneficial thing. We generally recommend to remove it on a daily basis because
Yeah,
plaque is what causes gum disease.
got it. So I know some people who eat candy all day and their teeth seem fine. I know other people who brush meticulously and floss well and eat pretty darn well, but they seem to get a lot of plaque and cavities, right? So there are other factors at work here. Obviously, we know
Oh,
that
yeah.
what we eat and our oral hygiene matters a lot, but it strikes me that maybe part of the issue is actually the bacteria that have taken up residency in a mouth that may lead to bad breath and oral decay. That those bacteria tend to form more readily in some people than others.
I'd love to debunk that myth. We've had evidence for so long, yet there is so much confusion in the community. So I'm going to set it straight. Decay is caused by sugar in the diet.
Okay.
Gum disease is caused by buildup of plaque. Now, bacteria is also important in decay, but if you don't consume sugar, you're not going to develop decay, no matter how much bacteria you've got in your mouth. Whereas you will develop gum disease. So here's how it is. Decay, you mentioned that some people have a lot of sweets and they don't seem to develop decay. Now, if you binge on sweets, if you have, let's say, 5 chocolate bars, but you have them all once a day, you're not actually going to develop decay.
Mm-hmm.
But if you have
Especially if you
sugar,
brush afterwards, right?
brushing does absolutely nothing to prevention of decay. Here's another
Okay.
myth.
Okay.
Brushing removes plaque and prevents gum disease, but it does absolutely nothing to prevention of decay. So to prevent decay is caused by frequency of sugar intake, even in small amounts. It doesn't have to be a lot. So people who have a lot of sweets, but they don't have them frequently, are not going to develop decay, whereas people who have a lot of sweets or even a little bit of sugar throughout the day, often hidden in processed products, are going to develop decay, whether they brush their teeth or don't brush their teeth.
Wow. Okay, so help me out here. When we say sugar, do you
Mm-hmm.
mean table sugar? Do you mean any form of added sugar? Does fruit count? What about flour? What about carbs, which convert to sugars rapidly?
Fantastic. Simple carbohydrates, table sugar, fruit sugar, glucose, sucrose, fructose, all forms of simple sugars will feed bacteria in the mouth, produce acid. A bacteria will in turn produce acid as a waste product, and acid will take minerals out of our teeth, and that is the process of decay. All sugars, and this is a message for vegans, molasses, agave syrup, rice syrup, date syrup, table sugar, all cause decay. Even fruits, and I'd love to talk about fruit, even sugar in fruit will cause decay. But having said that, remember what I said, it's the frequency that counts, it's not the amount. I advise my patients to never limit fruit. Fruit is so healthy. You shouldn't be thinking, I should reduce fruit, I shouldn't eat this fruit. You should be thinking, if you eat fruit, eat it with meals, eat it at meal times, perhaps 3 times a day, have 3, 4, 5 fruits at the same time if you like. The important thing is not to consume it throughout the day. Don't snack on fruit. And that's the biggest message I've got. Fruit is very, very healthy, but it does contain sugar. And if it's consumed frequently enough, will also cause decay.
But starches are different. So
starches are different, correct? Yes. Complex carbohydrates are different. There is some digestion that occurs in the mouth, and some starches do break down to simple carbohydrates with an enzyme that's called amylase. However, unprocessed carbohydrates there's not a lot of breakdown that happens in the mouth. Most digestion actually happens beyond the mouth. However, processed carbohydrates such as white bread actually does break down in the mouth. So if you look at rye bread that breaks down less in the mouth, white bread will break down more and therefore will also contribute to decay. Not to mention sugar that's added to white bread.
Right, absolutely.
Mhm.
Fascinating. Okay. So if somebody is going to have a bunch of sugar, you're saying, I mean, a bunch of sugar of any kind, including fruit, you're saying have it with a meal, ideally.
Yep.
Does it help to like swish with water or use mouthwash afterwards? Or what do you
Ooh,
think?
we actually don't have that much evidence to suggest that. You'd naturally think if you swish water around your mouth, you're going to neutralize, you're going to wash something out, you're going to neutralize acids. So sugar comes in different forms as well. Sugar, if it's a drink, it's in the drink form, it's going to wash off your teeth quite quickly. However, if you have chocolate or dry fruit, for instance, it's going to stick to your teeth. It's going to hang around. And no matter how much you brush your teeth or how much you rinse, it's still going to stick to your teeth and it's going to hang around for some time, and therefore it's still going to cause decay. So brushing your teeth after you've had something sweet or swishing water around your mouth is unlikely to make a significant difference.
Uh-huh.
Maybe a little bit, but I don't think we've got evidence to suggest that.
What about beverages like kombucha, for example, or alcoholic
Yeah,
beverages?
yes, yes. Often have sugar, but not always. They're very highly acidic though. So acid erosion of enamel is another process. It's not the same as decay. So decay is degradation of enamel and dentine, the hard surfaces of the hard structures of the teeth. But it is a completely different process to calcium and phosphate being leached out of enamel through the process of acid erosion. So acids below the pH of 5.5 so enamel starts dissolving. Now, drinks such as kombucha, cordials, soft drinks all contribute to that. Another interesting thing is citric acid
Yes.
is a lot more damaging than, let's say, carbonic acid. So when you think of a carbonated drink, it's carbonated with carbonic acid. It's a very mild acid, so it's not very damaging to your teeth. But when you start mixing that with citric acid, for instance, as is in a lot of drinks, that's when a lot of damage occurs. So mixing acids together is damaging, but also citric acid not only dissolves calcium and phosphate, removes that from enamel, but it also prevents remineralization of teeth as well. So it's quite a damaging acid. So my advice with that, if you have a fizzy drink or kombucha, again, don't have it frequently. Don't sip on it throughout the day. Have it as a treat from time to time. You're not going to cause much damage from that.
Interesting thing about the beverage industry, pretty much all
Mm.
beverages that contain calories, that is to say anything other than pure water, in my experience, I don't know if this is literally true, but everyone that I've looked at contains citric acid or the equivalent. And I think it's
Yes.
because they have to be acidic to a certain pH, a low pH, in order to be preserved for a long time for shelf life purposes. And so these citric acid is by far the most common one, but there are other acidifying compounds that are sometimes added. Kombucha doesn't have citric acid because it's already very acidic. And that
Mm-hmm.
low pH preserves shelf life, which seems to be integral to the beverage industry. So even bottled teas that you might buy, they're not just tea and water. Even if they're sugar-free, they're probably going to have citric acid. And our tongues may actually like that acidic quality. It's slightly sour, and there's something that we get used to about that. But the shadow of it is that it's not good for your teeth.
Correct. And I've learned something new too. I didn't realize that it's an important factor in preserving the beverage. But I thought we just like the taste of acidic drinks, and we do. We like fruits because they're acidic.
Absolutely. It's
But
that sugar acid balance that you look for in a, when we
here's
in a fruit.
here's another tip for listeners. If you do happen to have something acidic, the worst thing you can do is to brush your teeth straight after, because
That's
as
counterintuitive, isn't it?
it is indeed the acids remove calcium and phosphate from enamel, or at least weaken the surface of enamel. And if you go brushing your teeth straight after, you're actually going to scrape it away. But if you do nothing, or perhaps rinse your mouth with water to neutralize some of those acids and wait at least half an hour, 20 minutes to half an hour. Saliva is a natural buffer. It's protective. Calcium and phosphate from saliva will remineralize enamel and therefore strengthen the teeth again. But don't brush your teeth in that window of 20 to 30 minutes after you've had something acidic.
Got it. Thank you. Are there specific nutrients that can be beneficial or that some people aren't getting enough of for oral health? I'm thinking about things like calcium, for example.
Calcium is an interesting one. I don't talk too much about calcium because it's almost insignificant. I don't know if you had ads. I remember when I was growing up here in Australia, I remember ads on TV, a glass of milk, a slice of cheese, and a tub of yogurt. I don't know if you had those, but it's stuck in my head. And these ads were by Dairy Australia, and we're still getting them. We're still seeing them. We're getting posters from the Australian Dental Association by Dairy Australia promoting dairy being a source of calcium for oral health. But it couldn't be further from the truth. We don't really need dairy for healthy teeth. Do we need calcium though? Yes, we need some calcium. We know, excuse me, that calcium is important for bone health, and it's somewhat important for teeth health. Now, when teeth are developing, yes, there is a requirement for calcium, and low calcium intake could cause developmental defects in teeth. However, as adults, once teeth are developed, there's not a huge requirement for calcium. There is some calcium deposition and dissolution, but that mainly happens on the surface of the teeth, and it's more dietary related than how much calcium you've got. Yes, you need some calcium, but if you meet your recommended calcium intake, you're going to have plenty of calcium for the health of your teeth, and it does not have to come from dairy. It can come from sweet potatoes, broccoli, kale. There's so much calcium in plant foods, and they've got other nutrients, magnesium, the whole scope of nutrients that dairy doesn't have. And in fact, dairy's got insulin growth factors and all these other nasties bundled up with it. Yeah. So not a good source of calcium, even though it's got calcium.
Got it. Thank you. And of course, cow milk also has lactose, which I suppose is a form of sugar, right, on the teeth.
Lactose is a form of sugar, not very harmful, though.
I see.
It's interesting. Well, lactose, yes, it is a simple sugar. However, the interesting thing about dairy is it's got casein, and casein is protective for our teeth. So whatever lactose there is in milk is counteracted by casein. So milk doesn't decay teeth, but it's just not a healthy source of anything other than nutrients for a growing baby.
Right, a growing cow in particular, right? Yeah.
Growing cow in particular.
So I am curious, though, about a few other forms of sweeteners. Since you mentioned lactose doesn't degrade teeth, what about xylitol? What about some of the other so-called sugar alcohols? I had a dentist once that told me I should suck on xylitol mints because they would actually alkalize my mouth. Does that help?
It does, but I always focus on a healthy foundation, healthy baseline. What causes decay? Let's prevent it. Let's not try to put a Band-Aid on it. We can also talk about fluoride, which is also very helpful. Xylitol might be a little bit helpful. Fluoride is actually helpful in strengthening teeth, but these are Band-Aids. These are not preventative agents. Talking about sugar alternatives, yes, they're very helpful. In fact, I actually use stevia instead of sugar. Stevia is a plant. You can grow it if you like in the pot at home. You can tear off leaves. You can put it in your tea. Sure, it'll have a slightly different taste, but it is sweet. Xylitol, saccharin, there are a few sweeteners out there. Now, they are useful. In moderation, they are safe. However, we also know that quite a few studies from Canada and America demonstrated that introduction of saccharin, for instance, to the market increased incidence of inflammatory bowel disease. So in small quantities, they seem to be safe, but if people consume that a lot, there seem to be changes to gut microbiome.
Yes.
But I think stevia is okay.
That's with saccharin. We don't know that with stevia necessarily.
Stevia is newer, so there aren't as many studies, but we do know that it can change not oral microbiome, it can change gut microbiome to some degree, but studies have been done in rats, not in humans.
Right. And we use monk fruit sometimes as a sweetener in our household, as well as xylitol, as well as a bit of stevia, as well as a bit of coconut sugar from time to time. I don't think coconut sugar is the best of those, but any thoughts on the others, especially monk fruit? Have you used that before?
It's a newer one on the market, actually. Do you know, I haven't tried it myself. Does it taste good?
It tastes good. It's a lot like table sugar, but it's supposedly, doesn't have sugar calories in it, because it tastes sweet, but it doesn't do that in the body. I'm not entirely sure how the chemistry works, but it tastes good. So
okay, I must try it.
And with xylitol, if you have too much of it, it can cause indigestion. Like if you use a cup of it in a cake, it could cause indigestion. In smaller amounts, it doesn't cause problems. So I use it in mints and things like that, or it's good for like if you're going to use gum. But because it may have slight benefit, as you said. Back to fluoride, though, because that's a hot button topic, and you did mention it, so I don't want to let that go. A lot of people are concerned, of course, about fluoridation of the water supply.
Yes.
And yet, obviously, there's a difference between oral fluoride that's going through your entire body and, taking it orally versus topical fluoride, like a mouthwash or a toothpaste or a dental floss that's going directly on the teeth. Maybe you swallow a little bit, but for the most part, it's going on your teeth. Do you have an opinion on those two? And also maybe the difference between fluoride water that is naturally high in fluoride versus water that's had it added chemically?
Sure. Well, fluoride is beneficial for your teeth. There's no doubt. People argue about it. They're concerned. I understand concerns, but fluoride is beneficial. Again, I mentioned before, it's a Band-Aid. What happens with fluoride? So there's a natural structure of teeth is appetite. What happens is when teeth, calcium and phosphate leaches out of the teeth. If there is fluoride in saliva, it will actually get deposited into enamel and cause a structure that's called fluoroappetite. Fluoroappetite is more resistant to dissolution. So teeth become stronger and more resistant to decay and acids. So that's how fluoride is useful. Interesting thing is it's not systemic fluoride, so it's not swallowing fluoride that has that effect. It's the topical effect. So swishing fluoride around your mouth is what causes that process. Now, that's why toothpaste is very helpful. So fluoridated toothpaste. Fluoridated water has the same effect. It's not actually drinking of that water that has the benefits, it's the topical effect. So I guess we can argue that why are we fluoridating water? Why are we drinking this? Having said that, a lot of these concerns that people have been debunked many, many years ago. So it has been demonstrated in numerous studies that consumption of fluoride in small quantities is safe. So whilst I don't necessarily promote fluoride, I can also tell you that it is beneficial for your teeth. But if you have a healthy diet and you control your sugars and you don't have sugars too frequently, do you actually need fluoride? Not really.
Got it. Thank you. I think there are some concerns about drinking fluoridated water and its effect on overall bone health. Any thoughts on that?
Haven't seen any studies that confirm that. There are lots of suggestions out there, but I think there are enough studies out there to suggest that it's not actually harmful. Happy to look at further research, but that's what I've come across so far.
Okay.
And I mean, we've got studies going back to the 50s and 60s debunking a lot of these concerns.
Thank you. In conventional dentistry, there are a number of practices that are somewhat controversial in the natural health community. I'm talking about things like metal fillings, the amalgam types of fillings, perhaps the use of plastics, as well as, root canals themselves. Based on the studies, are there any things that are commonly done in dentistry that you think should be done less, or that naturally minded patients may want to think twice about?
The biggest flaw in dentistry that I think is the failure to talk to patients and to educate them and prevent diseases. When patients come in to a dentist for treatment of diseases, they got to understand that we only have a number of options. We can't offer you a root canal or this. We can offer you a root canal treatment or a tooth extraction, which is quite debilitating. So you got to choose between saving a tooth perhaps or removing the tooth. Now, concerns, again, there are lots of concerns and I've read them all online. Studies, I respect evidence. I look at what does the evidence say. We've got studies regarding amalgam fillings going back to 100 years ago. Let's cover one at a time. Let's talk about amalgam fillings. So the concern about amalgam fillings is it contains some mercury. The interesting thing about mercury is mercury can bind to in different ways. It can bind to other elements in what's called the organic compound or inorganic compound. So if you consume seafood, for instance, and you're consuming some mercury, you're consuming it in an organic form. Mercury in amalgam alloy is actually inorganic. And what that means is the compound is quite large. So even if you are ingesting traces of it from the surface of that filling, firstly, it's in very small quantities. Secondly, it's too big to pass the brain-blood barrier. In other words, it doesn't get absorbed into the system readily. It gets excreted preferentially. So the buildup of mercury in the body from amalgam alloy is very, very small. So is it a health hazard? I don't see it that way. And again, lots of studies have demonstrated that not to be the case. Waste of mercury is a problem, though. Removing fillings, putting it back into the ocean, that could be an issue. There has been a move away from amalgam fillings anyway over the years. I personally don't use it. It's got some other properties which are a concern. Sorry, I have to dismiss this. I'm sorry. So I don't use it. It has a tendency to crack teeth. But again, if you've got a choice, you don't have to go for amalgam fillings, and there are lots of choices these days. However, if you're thinking about removing amalgam from your teeth, I don't advise my patients to do it. And another interesting fact is when you remove an amalgam filling, that's when you get exposed to mercury more than when it's stable in the tooth. But again, it's not a huge issue, and people shouldn't be very concerned. Root canal treatments. The root cause is the documentary, I think, from a couple of years ago that alarmed people. It was subsequently removed from Netflix. I believe it was removed because it was grossly inaccurate. People, I understand how people are concerned when they watch these documentaries. These documentaries come across as credible. But there is a mention of perhaps infection not being completely cleared by root canal treatment, and bacteria from that infection circulating around the body causing all sorts of concerns. Now, a lot of these studies that were quoted in the documentaries go back to early 1900s. Weston Price was the dentist who did a lot of these studies. These studies were done before we even knew what causes infections in the teeth. How can we use this research from more than 100 years ago when we didn't even know, we didn't even have root canal treatments back then? So a lot of data is not credible in that documentary. Again, the choice is yours. Extract the tooth or do root canal treatment. They're the options we have.
Or prevent both by doing the things we're talking about today. We've got a lot of questions from Whole Life Club members that I want to get to, but I've got one more that I want to hear your take on. There are so many studies out showing how a whole foods plant-based diet is correlated with lower rates of Alzheimer's, cancer, type 2 diabetes, lower rates of obesity, lower rates of heart disease, longer life expectancy. Unfortunately, there's one area where the studies don't necessarily show a link between whole foods plant-based diet and positive health outcomes, and that seems to be dental health. And of course, it varies widely, but in general, whole foods plant-based eaters do not seem to derive particular protection in that area from their diet, and in some cases may actually have worse outcomes. So from what you're saying, a lot of it comes down to sugar consumption and frequency of sugar consumption. Is it fair to imagine then that in general, plant-based eaters tend to snack more and graze more, maybe consume fruit more or other sweet things dotted through the day, and that could be a central part of the problem?
Yes and no. Some people snack, some people don't. I don't. I have 3 meals a day, and I'll have fruit with each meal, and I don't have decay. And I see lots of healthy vegans, and the ones you can snack, but just don't snack on sugary foods. Vegans and whole food plant-based eaters do have protection in as far as oral health is concerned in many ways. For instance, consumption of saturated fats is inflammatory to the body, but it's also inflammatory to our gums. So there is a correlation between consumption of saturated fats and gum disease, for instance. It's probably not causative correlation, but nevertheless, it is significant. Also, protection. Also, if you consume whole food plant-based diet, you don't snack, again, not snacking on fruit, you are not likely to consume too much sugar. So you're not likely to develop decay. So being vegan per se doesn't actually protect you from decay or gum disease, but in some ways it does. And there's also another interesting study that suggests that hunter-gatherer societies have a different microbiome. So they tend to develop more pathogenic bacteria, more bad bacteria in their mouth. Vegetarians have better bacteria in their mouth, whereas Westerners are somewhere in between. So there is emerging evidence that whole food plant-based diet is actually beneficial in that regard as well.
Got it. Thank you. Fascinating. And of course, inflammation is behind so many health conditions today. And of course, it makes sense that an anti-inflammatory diet would be good for oral health as well. And we certainly see strong correlation between consumption of saturated fat and sugar and causing more inflammation. So when you bring those down, you can get a lot of benefits everywhere in your body. Now we'll get to some of the questions from our Whole Life Club members. B said, could you chat about teeth sensitivity, gums receding, and how we can improve these conditions?
Sure. Gums receding is caused by two things. One is gum disease. So brushing your teeth well, seeing your dentist from time to time for a scale and clean, that prevents gum disease. The other cause of recession is traumatic brushing. So if your toothbrush is hard and you're scrubbing your teeth too hard, you're going to traumatize your gums and cause gum disease. This will lead to tooth sensitivity. When there's a recession, you expose a sensitive part of your tooth, which is the root surface, and therefore teeth become very sensitive. Now, the best way to, the best way is prevention. Don't scrub your teeth too hard. Make sure the toothbrush is soft. Keep your gums healthy. But if you do have recession, by not traumatizing your gums any further, you will actually allow the root surface to naturally desensitize from calcium and phosphate in the saliva and fluoride. Fluoride is very helpful to reduce sensitivity. There is also a toothpaste, a Sensodyne toothpaste. I'm not sure if you have that or under a different brand. That's what we've got. It's very, very helpful as well at desensitizing root surface. Its sensitivity is harmless, unless it's caused by decay, of course. But if it's only caused by gum recession, it's harmless. And if you do all the right things, your teeth will naturally desensitize.
Thank you. Speaking of toothpaste, Nina asked, is baking soda good to use as toothpaste? She also said, what about charcoal? Are you whitening but decimating your oral microbiome if you use charcoal? And I will add also any thoughts on salt in toothpaste or as a toothpaste.
Okay. Salt, perhaps I will answer very quickly. I don't think so. I don't think there are any effects, not that I'm aware of. Baking soda, no. Big no. It's very abrasive. If you brush your teeth with baking soda, you will cause more sensitivity because you will wear the surface of enamel. You will get down to the sensitive dentine, which is beneath the enamel. You will cause sensitivity, you'll cause damage to your teeth. Don't use it. Baking charcoal. Charcoal is another one. Not a lot of research on charcoal. It's a fad. It also could possibly be abrasive, could possibly also be damaging. It does not whiten your teeth because it's abrasive. It removes surface stains from tea, from coffee. You can remove that with a scale and clean, but I don't recommend using either one of those. It doesn't actually intrinsically whiten teeth. The only way to whiten teeth is to actually professionally whiten them.
Okay, got it. And so speaking of that, Louise asked about how to naturally whiten teeth. And there are some treatments where you put this hydrogen peroxide kind of thing on there that you put on there for a half hour a day for a couple of weeks. I did it once. My teeth were whiter. I understand it doesn't have any real effect one way or the other. So I've heard on actual oral health, it's just cosmetic. Any thoughts on how best to whiten your teeth?
That's the only way. You got it.
Okay.
It's not natural. There's no natural way to do it other than to use either hydrogen peroxide or carbamide peroxide. It is topical. It's contained in your trays. Yeah, spit it out. If you have a buildup of saliva, to minimize ingesting it, spit it out. Yeah, you'll be swallowing a little bit of it perhaps. Is it harmful? Again, no studies to indicate that. Just because we don't have studies, it doesn't mean it's not harmful, but we don't have any evidence to suggest that it is harmful. It's been around for a while. You've done it, I've done it. That's the only way to do it.
Got it. Thank you. Andrew said, can you please speak about the microbiome in the mouth and digestive enzymes in relation to Crohn's disease?
I We'll probably not speculate too much about it because as we covered earlier, research is in its early days. There are very interesting emerging trends that oral microbiome, again, migrates to other parts of the body, and it definitely ends up in the gut. There are a couple of theories that suggest that it perhaps makes the lining of the gut more permeable. Different pathogenic bacteria can be absorbed, causing problems in other parts of the body again. But we do seem to have some evidence that suggests that oral bacteria migrating to the gut, especially the bad ones, can be linked with inflammatory bowel disease. That's as far as we know. Different strains of bacteria have been identified, and it's known that they come from the mouth. But there is not a great deal of research for me to talk about today, but there will be more in the future.
Yes, and that is almost always the case, isn't it? There's so much research happening, and we're always learning more. Barbara asked if you would discuss high oxalate foods in relationship to teeth. She said, before I knew about oxalates, I was eating a lot of foods like spinach that were high in them, and I began to get some cavities for the first time in years. Could there be a direct connection? The cavity stopped when I learned to vary each type of food, and that when spinach is steamed, it loses the negative effects of the oxalates.
I am not aware of any correlation between oxalates and decay. Decay is caused by sugar. It's a well-known, well-researched process. I am not aware of any oxalates causing any decay, and I would go further and say that I am pretty confident that it doesn't cause decay. So spinach is completely safe for your teeth. I suspect that perhaps something else was happening at the same time.
Got it. Thank you. Barbara asked another question. She said, I have a lot of root canals and crowns. What's the best way to care for such teeth?
The key there is, if it's a root canal filled tooth, that it has to have a crown afterwards, because it becomes a fragile tooth and it can fracture without the protection of a crown. So Barbara's got crowns already, which is good already. The best way to care about those teeth is in exactly the same way as you would care about teeth which haven't been treated. Reducing your sugar intake or sugar frequency, flossing and brushing your teeth really well. No other additional protective measures required.
What is your opinion on the water picks that, kind of blast water to the gum line, and also mouthwash?
Rather useless, both.
Okay.
Water picks, yeah, and they blow bits of food out quite well, but they don't remove plaque very well. So plaque is what's harmful, and the whole purpose of brushing is not to prevent decay, is to remove plaque off your teeth. Plaque is quite sticky, so it needs to be brushed for about each tooth, or each surface of the tooth, for about 3 seconds a day. Brush gently, but spend enough time on each tooth. It's the mechanical brushing of the toothbrush that will remove it. I don't believe water picks are good enough. They don't seem to disrupt plaque very well. Flossing is also important. What was the other? Oh, mouth rinses. Fluoride mouth rinse. People who are at high risk to decay benefit from fluoride mouth rinse. Again, it's a band-aid. I don't recommend it. I only recommend it to people who are undergoing chemotherapy or radiotherapy of the head and neck. Their salivary flow is reduced, so they're very prone to decay. Again, prevention of decay is the best thing. I don't advocate for fluoride mouth rinse. There is another type of mouth rinse, chlorhexidine mouth rinse, which is very helpful after surgery if you can't brush your teeth, but only up to a week or so. Listerine, all other mouth rinses, waste of money. Save your money.
Thank you. What about mouth breathing and training ourselves to breathe through the nose at night? Is that relevant?
Again, some studies suggest that if you breathe through your mouth, your gums might get more inflamed. How relevant is it? How significant? I don't think it is. If you've got a healthy mouth, most of us breathe through our mouth at night. So it's not, well, at least we sleep with our mouth open. I shouldn't say we breathe through our mouth, we sleep with our mouth open. Is that going to cause any deterioration of oral health? Not really.
Is it, if we get dried out, does that not cause the plaque to get a little more sticky?
Drying out effect has to do with saliva. So saliva is very protective. During the day, we have a good flow of saliva. At night, it dries up. So it's low salivary flow is correlated with increased decay rate. So the important thing here to know is a decay is caused by sugar. So if you have something sweet before you go to bed, then salivary flow is low at night, you're more likely to develop decay. Don't eat before you go to bed. There is no harm in your mouth drying out at night as long as there is no sugar around. And I guess it's not a bad idea to brush your teeth before you go to bed. But if your mouth dries out, it naturally dries out. There's no harm.
Okay, got it. Thank you. All right, wonderful. Well, I think we've covered all the critical questions that have come in. Dr. Helen, I just want to thank you so much for your wisdom and insight. Any other key things you want to say or wrap up things you want to share before we complete this time together today?
Fantastic. I think we've covered all the important topics, and thank you for the opportunity to discuss oral health. It's always a pleasure. There are so many misnomers in the community, and I'm always debunking those myths. I think we've covered everything.
Fabulous. All right. Well, thank you so much. Really appreciate the time with you. We've been talking here today with Dr. Helen Voronina from Australia, Melbourne, Australia, and a brilliant, wise guide on the journey of oral health and overall health. Helen, thanks again.
Thank you very much. It's been a pleasure.
When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read, how many webinars you attend, or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club.